everyone, this is Ola. In this video, I'll discuss briefly the regional anatomy of the neck. So we will discuss the muscles of the neck and the blood vessels. Let's start with the largest muscle, which is the sternocleidomastoid muscle. This muscle has two heads. Sternal head that originates from the sternum and clavicular head that originates from the clavicle. Both the sternal and clavicular heads join, and then the distal attachment of the muscle is to the mastoid process behind the ear. So the name of the muscle indicates its origin and insertion, sternocleidomastoid. The sternocleidomastoid muscle takes its signal from the cranial nerve number 11, which is the accessory nerve. The bilateral action means the action that results when both right and left sternocleidomastoids are working at the same time. And here what happens is forward movement of the neck, which is flexion. How about if one side only is working? This rotates the neck to the opposite side of the muscle. Like if the right sternocleidomastoid contracts, then what would happen is left rotation of the neck. How about if the left sternocleidomastoid muscle is contracting, then the resulting action is right rotation of the neck. The antagonistic muscles to the sternocleidomastoid are the splenius muscles. They are splenius because they take their origin from the spinous processes of cervical vertebra 4, 5, and 5, 6, and 7. And the distal attachment now is different. So we have two splenius. Splenius capitis, capitis means head. So the distal attachment of the splenius capitis is to the head bone, which is the skull, exactly to the mastoid process. So here we have two muscles attaching distally at the mastoid process, the SCM, which is a sternocleidomastoid, and the splenius capitis muscle. The splenius cervicis is attached distally to the transverse processes of cervical vertebra 1, 2, and 3. The splenius muscles do the same action. So the bilateral action is backward movement of the head, which is extension, and the unilateral action is to rotate the neck to the same side as the muscle. So let's summarize the movements at the neck. Flexion of the neck is done by the right and left sternocleidomastoid muscles. The sternocleidomastoid muscles are anterior or front muscles, and when they contract, an F action results, which is flexion of the neck. On the other hand, the muscles at the posterior side, the splenius capitis and the cervicis, when both right and left splenius contracts, then extension of the neck happens, which is backward movement. Right rotation of the neck is done with the contralateral sternocleidomastoid, which is the left sternocleidomastoid, and the ipsilateral splenius, so the right splenius capitis and cervicis. Left rotation is done with the contralateral SCM, which is the right sternocleidomastoid, and the same side splenius, the left splenius capitis and cervicis. The supra and infrahyoid muscles. Before discussing those muscles, let's discuss three important landmarks in the middle line of the neck. So this bone here is the hyoid bone, which is the only bone in the body that does not articulate with another bone. Down to the hyoid bone, we have this cartilage, which is the thyroid cartilage. And then down here we have the sternum bone. So again, hyoid bone, and then thyroid cartilage, and then the sternum. We have two groups of muscles. A group of muscle above the hyoid bone, so we call them suprahyoid, and another group inferior to the hyoid bone, so we call them infrahyoid. Let's go over the three suprahyoid muscles. The muscle in yellow color here is making the floor of the mouth, which is mylohyoid. Then the muscle that has two parts in green color is the digastric muscle. Di means two, so muscle with two bellies. Then this one in pink is the stylohyoid muscle. So those muscles are attached to the hyoid bone. The infrahyoid muscles are four. We have two superficial and two deeper. The two superficial muscles are omohyoid and sternohyoid. The omohyoid muscle comes from the scapula and then is attached distally here to the hyoid bone. Omo means scapula in Latin, so it comes from the omo region, which is the scapula. Hyoid means its distal attachment to the hyoid bone. If you look at this omohyoid here from the lateral side, you will see that a part of this omohyoid is deeper to the SCM. So there is a part that is lateral to the sternocleidomastoid muscle, and then a part deeper to the sternocleidomastoid muscle, and then a part that is medial to the sternocleidomastoid muscle that is attached here to the hyoid bone. The other muscle at the same level of the omohyoid is the sternohyoid muscle. Sterno means it comes from the sternum. Hyoid because attached distally to the hyoid bone. So its name indicates its starting and ending points. It's sterno because it comes from the sternum. Hyoid because it is attached distally at the hyoid bone. Deeper to the omohyoid and the sternohyoid are two shorter muscles. So if you look at them here from the other side, on the other side here, the omohyoid and the sternohyoid has been removed so that you can look at these two deeper muscles. This muscle here in pink comes from the sternum, so it is a sterno. And it goes here to attach to the thyroid cartilage, so it is a sternothyroid. The muscle above is thyro because it comes from the thyroid cartilage, hyoid because it is attached distally to the hyoid bone. So the name of the muscle indicates its starting and ending points. Now with the arterial supply. This is the arch of the aorta, and from the arch of the aorta we have three branches. From right to left we have the brachiocephalic artery, and then we have two left common carotid, which is the source of the blood to the left side of the head and neck, and left subclavian, which is the source of the blood going to the left upper limb. Okay, so from the arch, we have the left common carotid and left subclavian. Then where are the right ones? They come from the brachiocephalic artery. So the brachiocephalic gives you two rights, the right common carotid and right subclavian artery. The left and right common carotid arteries are the source of the blood to the neck and head. Then each common carotid artery branches into an internal carotid and external carotid. Internal means it's internal to the skull. So this enters the skull through the carotid canal and supplies the brain with blood. It does not give any branches outside the skull. It's stingy, keeping every drop of blood to the brain. And then we have the external carotid arteries, right and left. They supply the structures outside of the skull. So, for example, the facial artery is a branch from the external carotid artery. Now, with the venous drainage. We have the internal jugular veins, right and left. They take the deoxygenated blood from inside the skull and then exit the skull through the jugular foramen. Then each internal jugular vein joins the subclavian vein. So the left internal jugular joins the left subclavian and the right internal jugular joins the right subclavian vein. The subclavians drain the venous blood from the right and left upper limbs. When the right internal jugular joins the right subclavian, then we have the right brachiocephalic vein. When the left internal jugular vein joins the left subclavian vein, then we have the left brachiocephalic vein. The right and left brachiocephalics join so that we have the superior vena cava that drains this deoxygenated blood into the right atrium. Okay, we have the external jugular vein. And external jugular vein, because it drains most of the blood external to the skull, like from the scalp, from parts of the face, and so on. So the external jugular vein terminates into the subclavian vein. Remember that the facial vein terminates into the internal jugular vein. There is a muscle in between the internal jugular and external jugular, which is the sternocleidomastoid muscle. So this muscle here is a sternocleidomastoid, and the vein that is external to the sternocleidomastoid is external jugular vein. The vein deeper or internal to the sternocleidomastoid is the internal jugular vein. As you can see here, the facial vein terminates into the internal jugular vein. What you can see here is the external carotid artery, and the external carotid artery here gives the facial artery. It's one of its branches. Now, what is the carotid sheath? It's a sheath on the lateral side of the neck that has three structures. We have the internal jugular vein to the lateral side, common carotid artery to the medial side, and in between we have the vagus nerve. As you can see here, as you go up, the common carotid artery gives two branches, external carotid that gives us the facial as one of its branches, and internal carotid that enters the skull, supplying the brain with oxygenated blood. So what are the contents of the carotid sheath? It depends on the level. So down in the neck, we have the internal jugular vein, common carotid artery, and vagus nerve. How about the upper part of the sheath? It has also the internal jugular vein, the vagus nerve, but now it has the internal carotid artery.